You're tuned into Kenya's biggest conversation on this Friday, the 3rd of October. It's the final show for this week, and even as we get into some things today, we're getting into it proper. We'll have some of those. Our live streams are up on YouTube, Facebook, and on X. Our audience on KTN. We continue this show wherever you're tuned in around the city, through the nation, the region, and the world. This is the Situation Room. Ndu and Dennis with you this morning. And as we get into it, our guests for the next couple of hours are here for us to then really interrogate what's been going on and to see how we can get some answers getting into the end of it. Dr. Bill Muriuki is the KMPDU Regional Secretary, Central Kenya. He's here with us once again this morning. Good morning, Daktari.
Morning, Ndu.
How are you doing?
I'm well. How are you?
Fine, thank you. Karibu sana.
Santi.
We're also joined by Dr. Patrick Nyagah, who is the Chief Officer, Health Services, Kiambu County, and he also joins us this morning. Good morning, Daktari.
Morning to you.
How are you?
Very fine.
Karibu sana.
Asante.
Thank you for being here this morning. We're going to look into a number of issues today. Kiambu's healthcare crisis status, newborn dream deaths amid health workers strike. So many things going on at the same time. Let's look for some solutions this morning, gentlemen. But before we do that, Dennis, we'll talk to you about Comoros.
In Comoros, a country that borders Madagascar, Mozambique, and the Indian Ocean, a population of around 900,000 people. The economy is pushed by fishing, tourism, and remittances from their citizens who live outside the country. Also considered to be one of the poorest countries, yet they're surrounded by the ocean, and one would hope that they would have a lot of resources in it. But that's the situation. But the proverb they're giving us today: words are like spears. Once released, they cannot return. Words are like spears. Once released, they cannot return. Dr. Patrick, how would you interpret that?
Thank you very much. First, thank you for having us, and happy to be here. Mm-hmm. I would like to say that, those are words of wisdom, and calls for us to be careful with what we say, because words, being like weapons, they can cause a lot of damage. Words being used as bricks can build very strong foundations. Choices depends on what you choose to use the words with.
All right, Dr. Bill, how would you interpret that?
Thank you, Dennis. I think similar to what my senior here said, sometimes there are things you can say, and maybe you say them in the heat of the moment, but then how they make the other person feel, as they usually say in life, people can forget what you say, they can forget what you did, but they'll never forget how you made them feel. So you really need to be careful with how you make people feel, and words are a big part of how you make people feel.
For sure. Okay. So let's get into this conversation, shall we? 128 days, there's been a healthcare workers strike in Kiambu County. Medical doctors, nurses, clinical officers have not been at work in Kiambu County. Am I getting it right so far? No, just doctors. Just doctors not at work in hospitals.
For now.
For now. So doctors for 127, today now being day 128, have not been at work, citing a number of things. So maybe we start with you, Dr. Muriuki. We had this conversation with you previously where we talked about the reasons why doctors are not there in hospitals across the county. Are the reasons still the same? And have things changed?
I think the reasons are still the same. It's still the same strike. It's still the same issues that force doctors to go on strike. Issues that stem back from as far as 2024. Are things the same? No. I think we are now getting to the point where the county's attempt to cover up the mess that is there currently is getting to the point where it no longer can be covered up. In medicine, we usually say if you try to cover an abscess, a wound with a pus, you can change the dressings, you can make it look really neat, but then with time, the pus has to come out. So I think that's why we're even back here. I think the crisis itself has pronounced itself. Yeah. So I think that's what really has changed, not the issues. It's just now it's quite evident for anybody with two eyes to see what's really happening.
So from what you say is that things have gotten worse.
Things are already bad. I think the difference now is it's clear for everybody to see. I think for a long time, the county government's focus was the messaging around it, the publicity around it. They really focused a lot on making sure it's not in the media. But once people start dying, unfortunately, Ndu, and you'll know this, people don't die in silence. Everybody here on earth is loved by people, is part of a community, is part of a family. So once those numbers get to a certain point, one family can mourn in relative silence, but a community cannot mourn in silence. So I think now we are at a point where what is even in the papers is not to do with the strike, it's to do with what is exactly happening on the ground.
Okay. Dr. Nyagah, from where you are with county, what has been the reason from your collective perspective as to why doctors in Kiambu County have been on strike and for so long?
Thank you. First, I want to take a moment back and correct some few misconceptions. First misconception is that doctors in Kiambu are not working.
Okay.
That is a misconception that has been drawn by the union in the public arena. As doctors, even the doctors who are members of the union rarely appear in the public arena to explain medical terms and practices. But the politicization of healthcare has brought us here. I want to say that doctors in Kiambu are working.
Okay.
The difference is how many doctors are on the duty. Not all doctors are working, but a sizable proportion of doctors are working.
Okay.
Our hospitals are operational. All of them, not a single hospital is closed. All the services are going on.
Okay, so if you were to walk
However,
into any hospital in Kiambu today, you would find the doctors. You would find doctors on duty
anytime.
Okay.
Of 24 hours.
Okay.
For those who operate 24 hours, they operate in 24 hours. For those who operate 8 to 5, they operate 8 to 5.
Okay.
Now, there is this crisis that exists in the mind of KMPDU and its supporters. We do not have a crisis. We have a dispute with KMPDU, but they're escalating it to a crisis. My colleague has said it very rightly, that people don't mourn in silence, and I agree with him. I have been in practice for many years, 25 years. I was in this same seat during COVID. I led the teams of COVID combat in Kiambu. We had deaths. We had a troubled time. We had a crisis. But that's not what we have today. Let me say it this way. If, for sure, a village lost 20 babies, there will be hue and cry in churches, there will be hue and cry in villages, there will be hue and cry in the hospitals, there will be hue and cry in families. You will not need to be given statistics by doctors to know there's a problem. The community would have said it. We have not had a community perspective where you're saying, like I can give you examples during COVID in this and this villages, we had 11 burials within 7 days. But this crisis that they are trying to escalate so that they can achieve their union targets. You try to create a crisis in the workplace so that you can achieve union targets. Now, the place where they used to work, those who left, some left, some remained, some came back. That's the situation.
Okay.
And in that situation, we had mitigation measures. So we had a dispute. It has taken a little longer to resolve. However, the government took measures to ensure that services are not disrupted.
Which disputes are these that you're talking about that is in Kiambu County, and what stops the county government from handling this dispute with the union?
Let me tell you, my friend, in every dispute, it takes two to tango. And just like in marriage, there are 50-50 responsibilities. You, as spouse in the marriage, you have a dispute with the spouse. Even if you put your 100% effort to solving it, it can only give you 50% achievement. If your spouse also needs to put in 100% effort so that you get another 50%, or even 2%, then you get 52%. So I want to say this, that in all ways, the county government has two roles here. One is to keep the services running, which you've done very well. The other one is to solve the crisis. To solve the dispute with KMPDU. We have put our 100% effort, and that is the maximum we can do.
Which disputes are these?
The dispute is simple. That the union came up with a demand and gave us 10 grievances. As representative of workers, you have this problem. They listed them 1 to 10. We said, as equal partners, let's talk. Before you could even get to the negotiation table, they withdrew the workers. Some workers left, others remained. Then we realized, oh gosh, we got a problem here. So we got other workers to continue the work. Okay?
From where? From where?
Running.
From where? Where did these other
before this issue was escalated to a dispute, we had been having discussions. We have also been doing our own assessments. We had plans to hire workers. Back in the month of October, November, January, we had done quite a number of advertisements. There was a process that was going on for hiring. It was at the last stage by the time they pulled out the workers. So we just concluded our process.
All right. Let's go in stages here. So let's come back to you, Dr. Muriuki. So there's a number of things that's been said here by Dr. Nyagah. First of all, that this list of grievances, from before that, it seems as though you were working well with each other, and then that you came up with a list of grievances. I'm just repeating this from what he said and from what Dr. Nyagah has said. It seems as though KMPDU needs to meet a quota or a goal of enough noise making and to make it seem as though you've agitated, which is part of your KPIs, as it were. And so that's what needs to happen. And that doctors are at work. Doctors are working in hospital. If I were to go to hospitals in Kiambu this morning or yesterday, that there are doctors at work and that there are no issues. This is what he's saying. So where is this coming from, Dr. Muriuki?
I've always heard people say artists work best in the early morning hours because that's when your imagination can be as fertile as possible. And I can see my senior colleague here has come with a very fertile imagination of how things are very rosy. But it's because he's my senior colleague. I don't want to put this conversation and everybody watching at home trying to assess, do they need to believe him? Do they need to believe me? I just want to use logic. Now, there are several things that you would know if everything is okay in Kiambu. Number one, there are independent institutional bodies. Number one, let's pick a university like Kenyatta University. Kenyatta University is a university in its own right. It uses the hospitals of Kiambu level 5, Gatundu level 5 to teach its students, lecturers and students. During this strike, they have stopped that MOU with Kiambu because there's nothing happening. Students can't learn if there are no patients, there are no procedures. They have now moved to KUTRH. So if everything was okay and as rosy, Kenyatta University would have no reason to do that. Let's go to another institution, COSEXA. COSEXA is the largest training program for surgeons in East Central and Southern Africa. During this strike, because there's nothing happening in theaters and cases, they've also stopped training in Kiambu. Let's go to Ministry of Health. Ministry of Health is a ministry that is mandated to overlook implementation of policy at a health level. The Ministry of Health sends interns to Kiambu. It's in the month of July, it sent almost 700 interns. After a few months, it has looked at the situation on the ground, Dennis, and just said, you know what? Come back to the ministry, we send you elsewhere. There's nothing you're doing there. There's no learning. So you don't need to believe me as Dr. Muriuki, but I want to know Kenyatta University can be wrong, COSEXA can be wrong, Ministry of Health can be wrong. Let's look at even the deaths that are being reported by the hospitals. He said there are doctors' numbers. Doctors, we don't keep numbers, statistics, hospitals do. If you see your sister paper, Daily Nation, publish those numbers on the front page. This is a reputable organization with big law, with big legal advice. They would not publish something they cannot verify. In fact, today, I'm sure you'll be aware that Standard has actually found the mothers of these babies who died, and they're going to publish their stories. So, are also these people also imagining all these things that are not happening on the ground? And in fact, something very interesting happened yesterday, the governor wanted to prove this debate. Is anything happening? So he said, you know what, I'll go with a media station called Kameme to the hospital, and we will do an interview, a walkthrough, we'll show people. And they bought lots of fruits and spent the whole night cleaning the place. And then in the morning, they realized they have a big problem on their hands because, you know, you can invent stories, but you can't invent patients. I mean, even the Chinese don't have that technology. So so they had to cancel the trip last minute because surely...
And this is for what you know was going to happen?
Tomorrow, yesterday, on Thursday, the governor was supposed to go to Kiambu Level 5 with Kameme and the whole team. So eventually he had to cancel it, and they sent a few people to do a show in studio somewhere to say things are happening. But eventually... all I want to say, because I don't want to get into a debate where I have to try and convince people. I think the best thing I'd ever just say is use your own 2 eyes. Just take a walk. Every media station, every media company that has gone to those hospitals, check any report. There's nothing happening.
Dr. You've been accused by Patrick that the union and the county government were having discussions, that there were plans to hire new doctors, and it is at the tail end of the discussions that you withdrew the services. That
not even at the tail end, even before they had a discussion.
Before they had a discussion.
Yeah.
That we have a problem where it is... Healthcare in the county has been politicized by KMPDU because there are quotas that you have to achieve. Is that true? And if so, who is pushing the agenda?
Now, the thing is, the county government in Kiambu doesn't even have a problem with KMPDU. It has a problem with all unions, all healthcare workers, and actually all its workers. Even as we speak today, they haven't paid salaries for August. All the other unions on Tuesday actually say that this coming week, if the salaries are not paid, I think they want to start quickly trying to pay them from today. But we're talking about August salaries. Today we're in October. They are going to issue a strike notice. So it's not even an issue of KMPDU and having an agenda. But having said that, we've been having a very difficult relationship with the county. And we've really tried our best. And as I say, this issue started in in May last year, 2024. We had that document. We took it to court, an agreement. That agreement was not implemented. They took us round in circles. Nothing was done. Now, in October, we declare a dispute with the Ministry of Labour. We tell them, listen, come. These people are difficult. Help us talk to them. The conciliation meetings that were called, they never showed up. That is October last year. Then we come to this year. We issue a 21-day strike notice. And do 21 days are 14 days more than what even the law requires. And it's because we knew we have so many issues, we might need a bit more time.
Right.
The county government did absolutely nothing. Completely nothing. What they wanted to do was to wait for the day before the strike to rush to court, to try and make the strike illegal so that you're compelled to go to work. And that's why actually when they went to court, the court told them, you know what, that strike is legal. Let them just go on strike. Because there's no other avenue. when we talk, you're not listening. When we call for meetings, you're not attending. When the Ministry of Labour tries to bring us together, you're not showing up. When we give you a strike notice, you're not even calling for a meeting. So the courts just say...
The MOU that you had was supposed to be implemented between what period?
It was supposed to... There were issues that were staggered with timelines, but the longest timeline was 90 days from May, which was supposed to end, if I'm not wrong, at the end of September.
This year?
The last year.
Last year. Mm-hmm.
Yeah, and on that last day, we had a meeting with them. And in the morning, they just cancelled the meeting. So even as he talks about, there were plans and they were going to do this. These are the typical stories of, oh, don't worry, we have plans. And that's what brings us here.
Was there a conversation, Dr. Nyagah? I mean, the things that he said here, the things that Dr. Muriuki has said here, we're calling in several different institutions. Kenyatta University, renowned, it's KUT, RRH, the Ministry of Health, Kekoksa, everybody coming in here to say, okay, we have a problem. It looks as though there is a conversation, at the very least, a conversation was being had that was then, stopped in its tracks. Is that the case? Was there it sounds as though, even if in the very rudimentary of ways, there was something happening or not happening in this case. What really is the issue?
Thank you. First, I'm Dr. Nyagah.
Sorry, Dr. Nyagah.
The second thing is, I've talked about KMPDU and narratives. KMPDU are very good at spinning narratives. I think they have a hub for that. Because we've had, even when you're younger, we had stories of these kids who will go to a neighborhood, climb a tree and cry wolf, and the villagers will come. They will look for the wolf, there's no wolf. Run again, go up a tree, cry wolf. And the village kept on running. Then take that scenario and say, on the fourth tree, the kid will say, there's a problem because people have been running around. Mm-hmm. That is a kind of a narrative that's being created here. The first thing is KUTRH had a dispute with Kenyatta University.
Okay.
That has been going on for a very long time about use of Kenyatta University Teaching and Referral Hospital. This dispute has gone to Parliament. It has gone everywhere. KUTRH and KU had a dispute.
So their dispute has nothing to do with the Kiambu County.
While that dispute was going on, they were using Kiambu Level 5 Hospital to teach their students because the programs must continue learning as they sort out their dispute. Recently, that dispute was sorted, and KUTRH accepted to take students from KU. And so they moved their students from Kiambu to KUTRH. It had nothing to do with a dispute or training in Kiambu Level 5.
So why would they move students from Kiambu County if it had nothing to do with the county?
This is what I'm saying, that originally their plan, when they were doing their medical school, was to have a university teaching site and a university teaching hospital.
Okay.
The two went on together until the university teaching hospital was not complete by the time the registration of students was done. So they had to get a stopgap measure. What was that? Approach Kiambu Level 5 Hospital, which is next door, and take the hospital, the students to the hospitals meanwhile. And that one we wrote an MOU with them, and we have done that for close to 7 years. Meanwhile, when the KUTRH project had stalled, it was taken over by the ministry, and it completed. The new management of KUTRH said now this is a ministry hospital, it's not a university hospital, and there arose a dispute. So we kept their students for longer as they were sorting out that dispute between them. And recently, after several years, going to Parliament, to Senate, to dispute resolution, it was agreed. Let the university use the teaching hospital. And the logical thing to do was to draw the students from where they were temporarily. So this narrative now, this is where I'm talking about KMPDU creating a narrative. They look at that happening and start saying, look, the students have gone. It's because of today,
Because of what?
It's because of Kiambu County. Let me tell you, we have students from JKUAT. We have students from MKU. We had students from KU. We have students from Tangaza University. We have students from all these universities. The point is the withdrawal of students from Kiambu Level 5 Hospital had nothing to do with Kiambu Level 5 Hospital.
Okay,
that is number one. Let's go to the next one.
Okay.
Independent bodies. COSEXA. The director of programs, COSEXA, is a leader in KMPDU. He is one of those gentlemen who we've been negotiating with. I don't have permission to mention his name on here. I want to respect his private, whatever, is a good friend of mine. He, illegally so, and this is something that we will deal with at another time, illegally so, wrote a letter on his own volition after a meeting with KMPDU and instructed students to get out of Kiambu hospitals. The students were going on for 3 months while we are negotiating with KMPDU. One negotiator in that team who was representing KMPDU in the negotiation happens to be the director of programs at COSEXA.
Okay.
And that director of programs has a written letter, which I will produce at another time, instructing students to stop learning and go wait for KMPD. And we asked, what's the relationship? So you do not write to students, tell them go out, then point a finger, creating narratives. Then let's go to this other one, Ministry of Health. We have written seriously to the Ministry of Health because what has happened in Kiambu has never happened anywhere in the history. It is both illegal and unconstitutional because the Secretary General of KMPDU wrote a letter to the interns in Kiambu instructing them to go to the ministry and get redeployments. Now, let's get this into perspective, that the internship program is a mandate of the national government. However, it is run in the county government. It's a collaborative affair
between the Ministry of Health
and
the county. Okay.
The regulator is Kenya Medical Practitioners and Dentists Council.
Council, not the union.
Not the union.
Okay.
In the three tripartite bodies in this relationship, KMPDU has no role. Okay? KMPDU is a labor union. It takes care of welfare issues, not training issues. But because doctors are members, and because KMPDU took part in fighting for that internship, they have some influence with the interns. So they use this influence to pull out and create a crisis in Kiambu.
Okay.
Let me finish.
Okay.
Let me finish. This one is very important. Before the narrative takes another angle. We have letters from the interns requesting not to be moved. They have been taken to the ministry by the interns themselves. The ministry has not responded. We have written to the ministry asking, why did you withdraw there? In the normal circumstances, where there is a problem in an internship program, there are two remedies. Number one, the intern themselves report we have a problem. They report to the KMPDC. KMPDC calls or visits the area where there's a problem. If there's no resolution, the intern is moved out. KMPDC has never written to us. KMPDC has never visited us. The ministry has never written to us on a problem. It has never visited us. KMPDU wrote a letter on Sunday night after we had a meeting with interns on Friday, redistributing the interns for their second rotation, and said, for us to show like there's a problem, these interns, our friends, they have to come out. That letter is circulated. It's signed by the Secretary General, Dr. Davuj. It's not signed by any official of the three. So you see the three issues are created to create a narrative. And so he comes in here and says, look, These are independent. These are not independent. These are actions related to KMPDU escalating the dispute. And that is the truth as it is. Now, let me talk about Kameme. Because when you believe in a fable, you can always get evidence for it.
Okay.
We have a dispute with KMPDU which has been politicized. And the people take their healthcare very centrally. We also focus on healthcare very centrally. When there was a lot of misinformation out there, there was a real danger that people might believe the misinformation and stop coming to hospitals. Now that creates a real problem because people who are sick and are not coming to hospital are a real nightmare. People who are sick and are coming to hospital are already, there's a solution. So we were worried that people might stop or slow down because of the misinformation out there. So what we do, we look for an avenue to communicate to the people that those stories we are hearing are about another dispute. They are not about healthcare services.
But Daktari, one would argue that the best communication for any institution would be if services are there, people will just walk in and seek services. So you don't have to go to a media house to communicate that hospitals are working. Kenyans themselves will tell you that services are there and you're being attended to.
I agree with you entirely.
Then why do you have to go to a media house to say that a hospital is working, if at all it is working?
Now look at it this way, my friend. The hospital is working and I can give you numbers. And you can also go to the website of the Ministry of Health, see the number of patients seen. You can come to the hospital and see the patients. And I can invite you even after this show we go with you. I've not prepared for that. But you can always go there. You can send a patient. I can tell you, in the last 1 month, Kiambu Hospital has had more than 500 births. Who are those? What was going on? The problem is, if somebody is on the crossroads saying the work is not going on, it will only take information to the people who are not sick to take decision when they get sick. So the patients themselves know that it's working. They are coming, they are getting care. But the ones who are not sick need to know when you get sick, the hospital is working. Otherwise, you deal with those who are in the hospital, they get well, they get out. The ones who are out there don't come. Then, yes, you have a crisis. The point is that's a crisis they are trying to create. And we have to communicate to the normal people also.
Okay.
And we went out to the normal people.
What?
And we called them. And we had patients talking. We had cameras in the wards. We have babies walking around. We showed you that this thing is working. So that misinformation, and in the nature of politics, propaganda flows before the truth.
Well, let's look at this issue because there seems to be many fires burning at the same time, and that there wouldn't be attention given to it from any side if there wasn't actually an issue. That there's too much going on for it to be about nothing. So, Dr. Muriuki, Dr. Nyagah has said some very interesting things this morning, and he's
quite creative.
And he said that all of these things are happening independently of each other and have nothing to do with Kiambu, but somehow Kiambu is involved and at the county level.
I think I need to clarify that.
Is it?
What I said,
Chief,
is that these things are related, are created
by KMPDU
to escalate a dispute that we have with KMPDU.
Okay, so we'll come back to what
we have a dispute with KMPDU,
we'll come back
but
to
they're
the
escalating
dispute.
it in things that are not related.
We'll come back to the dispute because that's at the heart of the matter here, and that's what's causing all of these things.
Exactly.
Because there is a problem. We can't run away from that. And we know that there are doctors who are not at hospitals. There are doctors who are not working at hospitals. So whatever happens, it has depressed the situation of healthcare in Kiambu County. We can't run away from that reality.
So,
Dr. Muriuki.
In fact, as he speaks, for anybody who's ever been in a very toxic relationship, you get into this cycle where your partner admits things are bad, but somehow it's not their fault. Oh, KU, it has nothing to do with us. Oh, MOH, it has nothing to do with us. Oh, COSEXA, it has nothing to do with us. But in itself, he is admitting these things are going wrong. It's just that what we are lacking is accountability. He is honest, just not accountable. Now, I'll just respond to the issue you're saying about interns. Our National General Secretary, Dr. Davji, wrote a letter to our interns. Our interns are members of the union to go collect the letters. But the letter is written by Ministry of Health. And because I knew...
Not Dr. Teller.
Can you produce a letter?
You know, the good thing, we've been in these negotiations for so long that I know what the chief was saying. So today, I came with a letter. This is an example of a letter. And this is a Ministry of Health letter.
So the one that Davji signed...
Okay. You say there's no letter,
the one that
I think I'll just put this on the table, and Dennis, you can look at it. It's a letter from the Ministry of Health, and if you look, and you can read for people at home, it basically just, maybe you can just say what it says.
So the letter says, Medical Superintendent Naivasha Sub-County Referral Hospital, variation of internship center for medical officers, interns. The internship center for the following medical officer interns have been varied as follows. The interns are expected to report from 6th October 2025 and not later than 15th October 2025. You are therefore requested to inform us when the interns reports to facilitate our further necessary action. Kezian Jonjo for Principal Secretary, Cabinet Secretary, Ministry of Health.
Exactly. So
this letter comes from the ministry?
The ministry. So interns are not posted by the union. They are not under the union. The letter is referring to was our union Secretary
on
General
this letter? Okay.
acting on this letter.
Okay, hold on.
Chief,
Let's just hold on. Let's finish
just
this
calm
so that
down.
we can follow.
Yeah, so it's okay. Once I start producing documents, he'll get worked up. So I know you for 4 months now, so let's just be prepared for that. So the union doesn't post interns. What our National Secretary General was telling our doctors, the interns, go collect your letters from the Ministry of Health, right? So he's not the one writing you a letter. He's telling you, as the person who represents you, I have talked to the Ministry of Health. They've told me they have your letters. Go collect your letters from tomorrow 9 a.m.
Okay.
Now, if you even want to know, this is beyond us. And the good thing of being a young person, as much as I respect my senior, there are things that are so easily provable. You just need to go online because we are digitally native. Anybody at home, please just open the Clinical Officers Council, the ones in charge of clinical officers. Just open their Facebook page. They've actually posted a message to clinical officer interns in Kiambu to go collect the letters.
They've done the same thing?
Yeah, just on Facebook.
Okay.
I'm sure maybe a senior like my colleague here doesn't probably know that exists or that can be easily checked, but clinical officers have said the same, and today you'll see the nursing council say the same.
Let's just get some clarity here, okay? What Dr. Nyagah has said is that KMPDU essentially has told interns to withdraw.
No.
Okay, no. Hold on. He has said that KMPDU has written the letter and told them to demand either movement or call up to a particular place. Yes. What you're telling us is that KMPDU has basically reaffirmed what the ministry has told interns to do for interns. Clinical officers have done the same, and other medical practitioners have done the same. And nurses have done the same. And this has come as a directive from the Ministry of Health. So this letter that he's referring to, what you're saying is a buffer to the original letter that has come from the Ministry of Health. That's what you're saying?
Yeah, and don't take even my word. Let Dennis read the letter from the Secretary General.
Let me read the letter. The letter is here. And so this is from Dr. Abdi Bachi, National Chairperson, Secretary General Davji Bimji Atela, and Dr. Martin Nabwire. And dear interns, the reference is mandatory redeployment notice for Kiambu County interns. Let's go to the substance. Following the letter from the Ministry of Health dated August 26, 2025, indicating that you will be redeployed to different stations in the country by September 15, 2025, if the Kiambu strike is not resolved, we would like to communicate that the letters for transfer to other stations are ready. All interns currently in Kiambu County are therefore required to collect the redeployment letters from the Ministry of Health effective tomorrow, September 29, 2025, from 9 a.m. As the strike in Kiambu is now in its 4th month with no end in sight, there is an urgent need to protect the sanctity of the internship, and it should not be affected prolonged county strikes. Therefore, failure to collect the redeployment letter and move will be deemed abscondment of internship duty by the MOH. In solidarity, Dr. Bimji Tell G.
So
Tell
as you can see in our SG is telling our interns, in reference to the MOH letter, go collect your letter at MOH. He's not redeploying you. He's not in charge of where you work. He's trying to say we told our interns to go elsewhere, but you don't even have that power. The letters they collected, this is an example from the ministry, and those are for our interns.
Okay.
Those are pharmacists, dentists, and doctors.
Okay. The clinical officers did theirs, nurses
and
did theirs.
anybody at home, just open their Facebook page. It's the most recent post. In fact, if you can put it up there, I'm happy I can read the screen. There's someone who said they were yesterday at Gatondo and there was nothing happening. It was deserted. And that's what I'm saying. The problem of truth is so stubborn. You can try to hide it, but it will always just open. So instead of believing, let's just open. We see what the clinical officer has told their interns, right? So that you know this is not even a KMPDU issue. It's different bodies looking at the situation in Kiambu and saying, you know what, for the purpose of our internship, please go to MOH and collect your letters and get the hell out of Kiambu, right? So it doesn't even matter if you want to believe it is KMPDU that is problematic. Different people are looking at the situation in Kiambu, visiting the ground and saying, you know what, there's nothing going on there. So maybe I'll just give you time to find it so that even people at home can see.
So we're looking at KUKO, isn't it?
No, not KUKO, Clinical Officers Council.
Okay.
Yeah, that's KUKO now is their union. Actually, that's the difference between the board and the council for doctors. Clinical Officers Council. Yeah.
All right, so let's take a look at that and see if they've also put up Kiambu interns redeployed to the new internship centers. Well, that's the letter there. It's 11 hours ago. And that
Can I read
letter
it for people at home?
you can read it. This is what's on the Facebook page. So this is what the purpose of what we're doing here is just that we can clear up issues here. That you said that the same kind of information that came from KMPDU, which Dr. Nyagah has spoken about, is the same thing that's happening across cadre of medical workers or healthcare workers. So
telling their own interns, get the hell out of Kiambu. There's nothing happening there. There's no internship.
So you can. I don't know if you can see that.
I can read it very well.
Okay.
This is the Clinical Officers Council homepage. All clinical officer interns serving in Kiambu County hospitals have been redeployed across the country. This directive affects interns attached to Gatundu, Thika, and Tigoni. According to the Ministry of Health, the ones who post interns, the interns are required to report to the secretary on 3rd and collect their redeployment letter. This is what Dr. Davji was telling our interns.
Okay.
The ministry emphasizes that all affected interns should comply. Interns are therefore advised to make immediate arrangements. This is not even KMPDU. You get, like, that's why I want to just paint a picture here. You'll see a pattern where the county just alleges things. They're very imaginative, they're very creative. But any single issue is so demonstrably easy to prove. It's just that I think we're dealing with a generation that was there before technology. So they don't know you can actually just Google and check that. I'm probably sure my senior here is very shocked. But these things exist.
I think...
So let me just finish with one thing. The nurses also will be getting their letters. The council is communicating, I believe, today. And it's the same. And we are talking, just to put into perspective, we're talking about 700 health personnel across different cadres being pulled out of Kiambu. So when I started by saying this is a catastrophe that is going to turn into a full-blown crisis, that's where we are headed. And it's not my wish, but I really wish we could even just accept the reality so that we start solving the problem. Because if you notice the fundamental problem, and this is the last thing I'll say, the fundamental problem we have here with the county is we are not living on the same planet. I really love the planet that my senior here is on. It's very rosy, everything is working. In fact, there are no deaths, nobody is dying. People should even come from across the country to visit Kiambu and benchmark. But that's not the planet we are living in, unfortunately. So if we could get to the same page, then we can move forward.
Okay, is that page, or what does it look like in terms of, at the very least, agreeing that there is an issue, Dr. Nyagah?
I think it is fair and very fair that we all agree that nothing happens in Kenya, everything is done. So it is not possible for us to look at results without looking at how did we get here. That is very important. He is demonstrating results, and very happily so, of work he has accomplished. by escalating.
Okay.
By escalating.
Could he have accomplished that? Yes. Could he have accomplished that for KMPDU? Could he have accomplished that for the Clinical Workers Council? Could he have accomplished that for the nurses?
I also wish I could, but I can't.
I'm sorry, but I think we need to be clear here because there is, of course, accusation that KMPDU has been very political in this. And whereas there is room for that, we must also be couched in fact. Is it possible that they've roused up the interns to say, stay away from Kiambu? If that were the case, would we see the same happening with clinical officers and nurses coming from the Ministry of Health? Could we see the same thing?
You need to give me time to...
I'm asking the question so that we can set...
I think you need to give me time to interrogate.
Dr. Nyagah, okay. Dr. Nyagah, I've set it. So I want you to please explain how it's possible that if indeed it has happened with the union, how is it possible that the exact same information has happened with clinical officers as well as nurses? Please.
Let me take it fast.
Okay.
A little step behind with the two letters.
Okay.
First, your colleague here read the letter from Dr. Davji. What he left out is the date of the letter. What is the date of the letter?
The date of the letter is September 28th.
Mm-hmm.
What is the date of this letter?
September 29th.
Now, look at that.
Mm-hmm.
The union issued a letter about letters that were not ready. And this is what I want you to understand.
Okay.
The union was in the ministry. There is a nest in the ministry. And you don't need to think too far to know why the ministry at this moment would be parting with the union. You just need to look at the past officials of the union and the current officials of the ministry. Then you'll find they're the common people. They are doing the same thing. And this is a common denominator. We do not have a problem with the clinical council union. Like all the other clinical officers are working. We don't have a problem with the nursing union. The union, all the nurses in Kiambu are working. But they're all controlled from one center in the ministry. And who is sitting in our ministry? Our official or an ex-official of KMPDU. And for that reason, we have protested the nesting of KMPDU in the ministry and taking up the arms of the ministry to propagate the activities of the union. And that is what is demonstrating here. And you've asked it only without understanding of what happened before the action is demonstrated.
Daktari,
okay.
The point here is, before you ask me the next question, the point here is the dispute is being magnified to areas it is not involved. We do not have any dispute with the other councils. We don't even have a grievance letter with them. We don't have. But to our surprise, they are issuing the same letter after KMPD has said they will be issued, which means at the point of making decision that those letters will be issued, the people were in the same room.
Are you saying that there's somebody who is sitting in the ministry who has pandered to the whims of the KMPDU doctors' union and has gone ahead to issue letters to other councils under the Healthcare Workers Service by virtue of the influence from the union, because this is an ex-official of the union? That's very serious.
That's a very serious observation. And that is exactly what we have written to the ministry.
I have a question.
And what you're saying here is the involvement of nurses in this issue, the involvement of clinical officers in this issue will have to be interrogated because there's no dispute. We have letters from the interns themselves. Given time, I can produce them. The interns have written. There was a night meeting between the Clinical Officers Council and the interns in Kiambu the day before these letters were written. And I attended that meeting. And they said clearly, we do not want to move.
How would you prove that there is somebody who is sitting at the Ministry of Health who is a current or ex-official of the KMPDU who essentially is pulling strings to make sure that interns are moved, but beyond that is also pulling strings in other councils to ensure that their health workers move as well? Do you have a substantiative evidence to show that that is actually what is happening?
I said it appears that the decision was made on the same table, and this is an issue we have protested, and this is an issue that requires an inquiry.
Did you get an answer back from the ministry when you made the inquiry?
They have not yet replied to us.
How long ago did you make this inquiry?
We've written twice.
Since when?
Since when?
Immediately after they wrote this letter, and the day after, before yesterday.
So September 30th and then the 1st of October, we're talking about 2 days ago.
Around there. Then when the interns wrote to us that they're being told to move, we wrote again.
Okay.
We do not have those two replies.
So those are 2 days ago.
We'll be seeking those replies because in this dispute with KMPDU, we want to know the nexus between KMPDU and the nurses, the nexus between KMPDU and the clinical officers. The only nexus we can find is that all of them are regulated by the Ministry of Health. That is the only nexus. So we want to know, as counties, what is the nexus of decision-making, that if you have a dispute with one cadre, and we have 35 cadres in there, that people can pull other cadres and create and magnify a crisis. And we want to know what constitutional mandate did we have as Council of Clinical Officers to withdraw clinical officers where clinical officers have not complained. So these are issues that we're going to move forward. But they should not be used here on this table, and you should not give that platform for them to be used to propagate, to escalate the dispute with KMPDU.
What we have here is we have letters from both the ministry. We have the letter from WTL that you've issued, and you've also seen the letter that has been written by the council. But the question is, Dr. Muriuki, if you could confirm, all the letters that came from the ministry, are they dated the 29th of September, or are there letters that came earlier?
No, the letters, maybe I can give a bit of background to this. The letters are dated the day you collect them. He's trying to make it look like in fact, I really like how he's portraying the union. He's making us look like we are very powerful. We sit in the ministry and we are moving difficult arms at the same time. And what I like about that is you wonder then why are even we in this dispute if we are that powerful?
So that means if I go collect my letter today,
yes,
it will be dated today.
Yes. In fact, the clinical officers have been told to collect the letter on 3rd. The letter is going to be dated on that day. So that's not even a mystery. I think what I'm really enjoying from my senior here, as much as he's older, he has a very Gen Z mentality of we have haters everywhere and everybody hates us. And he's also buying into a lot of conspiracy that there are people, there are offices. The nexus of this issue, Dennis, is very simple. All these interns work in one place. If that place is not working, it doesn't matter if, it doesn't really matter if we have different councils, we have different bodies, we have different ministries. All these interns have been sent by different institutions to do the same thing. That is the nexus. Saying there is a very shadowy character, very powerful at Ebo H, who can even infiltrate multiple councils, is the stuff of legends. Is a kind of talk you have after work.
Is there an ex-KMPDU officer who is at the Ministry of Health?
In fact, I'm wondering
what is their position?
I'm wondering why he's afraid to name it. It's a public officer. He's Dr. Uma Ologa. He's a principal secretary. Okay. Yes, but these letters even originated from the cabinet secretary.
We're talking about the PS. Okay.
Yeah.
Okay. All right.
Yeah, we're talking, but these letters even originated from the cabinet secretary. Now, Kiambu County is not the only place even KMPDU has a dispute. It's not even the only place that has a strike. If the same principal secretary is in the office, why is he not withdrawing interns elsewhere? It's because the situation in Kiambu is bad, to the point where even if you sat in the clinical officers council or the nursing council, you'd look at the situation and ask yourself, me as Dennis, I've sent interns to Kiambu to learn. It's 4 months. There are no procedures. There are no senior doctors teaching them. Why are they there?
And that
You
leads
just
me.
withdraw
That leads
them.
me to the question, Dr. Nyagah. We see all these letters coming from KMPDU, from the ministry, from the council, from the Doctors' Council. There is also the letter that is coming from the Nurses' Council that would be coming out. Are you at any point concerned as to why all these letters are being directed to Kiambu County to redeploy those who had been seconded to Kiambu County? Is it a concern to you in any way?
As I've said, it is a concern that KMPDU would pick and escalate a dispute outside its context and get support for it.
Would KMPDU have any influence in the Nurses' Council and the other councils?
Through the ministry.
How so? If
I've just
KMPDU
explained
does not
there's
work in the ministry?
that these decisions are made at certain offices. The office I hold in the county government is that of chief officer. That office in the national government is a permanent secretary. We are the agent that runs the department. They are the agents that runs the government. What my minister does, they consult with me. What I do, I consult with the minister. All the committees that sit in my department, I either appoint, sit, or delegate. There's nothing that happens in the department where a chief officer is not aware. There's no decisions that are made. There are no committees, there are no resolutions that are made that I'm not aware.
Okay.
What I'm trying to say here is, and what I don't want lost here is that there was an procedural application of that power. Because
By the PS.
whichever office did it, as you said, I called for an inquiry. I have not got to the point where the inquiry has concluded by who.
Okay.
So I'm not saying so and so did it.
So we
what
need
I'm
to-
saying,
yeah.
let me finish. The procedure of withdrawing interns requires an assessment and a complaint from the intern. And if not the intern complaining, someone to complain. That is okay. But an assessment of the center to establish the fact. There is no assessment that has been done in Kiambu since 2 years ago by the Council of Nurses, by the Council of Doctors, by the Council of Clinical Officers. They sent us these interns in July in recognition of an assessment they had done earlier. And if there was a complaint, the procedural, the legal, the administrative way of doing it is to go and do a reassessment. And we've been running internship programs in Kiambu for the last 20 years. We've had multiple reassessments. Anytime there's an issue, we get a reassessment, we collect, we move on. Anytime we are adding in a medical school, we get an assessment, we qualify or we don't. We have qualified as a teaching hospital for MKU. We have qualified as teaching hospital, Tangaza University, for KU, for JCOT. We have qualified as teaching hospital for all these areas. Anytime even those students who are going to be doctors have an issue, there is a reassessment of what has progressed wrongly. All these letters we are being shown have been issued without a reassessment. It is a procedural misstep, but it's a powerful one to escalate a dispute. And that is a point that should not be missed here, that the powers that have released the letters are powerful, but they have not done the procedural steps in releasing this. And for that, that's victimizing the victim twice.
These things that you're speaking of happened in the period of about a week, right?
Yes.
A couple of days, actually. I don't think we've gotten to a week. Between September 29th and today, the 3rd of October, those are 4 or 5 days, give or take. But the genesis of this dispute is months back.
Exactly.
And that's what I want to go back to. Are we really saying that look at all these things that are happening and look at the temperatures that are rising in the manner in which they are, that there's nothing wrong at Kiambu between doctors and the county?
I've said, and I think you get this clear, from the word go, we have a dispute with KMPDU.
Okay, let's go from that point.
That is where the issue is.
Dr. Nyagah, Are there doctors that are not presenting themselves at hospitals in Kiambu County?
Yes.
Why are they not presenting themselves?
Because of a dispute.
Whether it's 1, whether it's 10, whether it's 50. What's the reason why?
Because of a dispute with their union.
The doctors have a dispute with their union, so they're not coming to the county?
Excuse me. Because the doctors are not coming to Kiambu, because that fraction of doctors, not everyone, that fraction of doctors are not coming to Kiambu because they are members of a certain union.
Okay.
So that has a dispute with Kiambu.
Okay, let's take this apart a little bit. The particular doctors that you say that are not coming to work are only doing this because they are the doctors who are coming or rather, let's start again. The doctors who are not coming to work, are they all members of this particular union that you're speaking of?
Yes.
All of them?
All of them.
All right. The doctors that are coming to work have no affiliation with the union at all?
No.
All right.
Let me clarify that, because the no might not make it.
I mean, it's clear. It's two things here, Dr. Sorry, Dr. It is. It's because based on what you said. I'm sorry. Hang on, please. You've said very clearly that the reason why doctors are not coming is because there is an issue with the union. The only doctors who are not coming to work are members of the union.
No.
Oh, so there are others apart from the union.
That's why I was trying to clarify.
All right, let's go. Okay.
We have doctors who are members of the union who are working.
Who are coming to work. Okay.
We have doctors who are not registered members of the union who are working. We have doctors who are registered members of the union who are also working. We have doctors who are members of the union who are not working.
Do you have doctors who are not members of the union who are not working?
No.
Okay. So you're saying the issue here is the union?
The issue is a membership of the union and followership of the union.
All right.
So if you follow the union word for word, you are not working. If you follow the union with certain level of level-headedness, you are working.
So what is the problem? Why are they not coming? Let's say there are 3. Let's say there are 3 doctors who are not working and they're members of the union. What are the issues that they've brought forth to say, handle this or we can't come to work?
I said earlier that the union representing those doctors who are not working, and also the others who are working, the union as representatives of the doctors in the labor dispute brought up 10 grievances. Those grievances are best known to the secretary. And what I know them, but he knows them better.
Isn't that the problem then?
We sat through 10 sessions and negotiated every grievance and how we will sort the issue. And we agreed on all the 10 issues.
So you agreed that there was an issue?
We agreed there was an issue, and we agreed on the solutions.
Okay.
We agreed on the issue and the solution. In every labor dispute, there is a grievance, there is a discussion, there is a way forward. We've agreed on the 10 issues.
Dr. Muriuki, the last time we had you here, you mentioned a situation where, despite the crisis that the county finds itself in, that the union, through its due diligence, ensures that you have some doctors who show up to offer partial services to the county. Is that the correct position?
I really love that you remember that, because that is exactly what he's trying to obfuscate there by saying there are members of the union who are working and there are members who are not working. I even personally got lost in that whole thing he was trying to paint, but that's the truth. This strike, and just let me explain at length, because I've seen he goes, I can see why the...
And while at it, you can also tell us how many doctors, if you have the numbers, do work in Kiambu County. And in terms of, and if all of them who are registered to you, how many are those? How many have withdrawn their services? And how many offer partial services? Just so we understand what is happening.
So I think the thing is, when we started this strike, we really didn't want to lose a life at all. I can see even people at home saying, when 2 people fight, the people who get hurt are the people at home. And that's why we came up with a minimum service protocol. Allow me to deviate from your question a bit, because it goes to the heart of what is happening now. Ndu, when someone dies, I take it very personally. As one of the chief engineers of this strike, I make sure to try and investigate why are there deaths, because we've given doctors, union members, to go work in those hospitals, and these are very qualified doctors. Now, whether they are, all these doctors are our members. In fact, even Chief here, as much as he's looking quite combative today morning, I can tell you, in the Central Region register, he's number 309. His DU number is 08403. So he's also a union member and he's working, right? He's part of the people we gave to coordinate services. He was also part of the list because he's a senior person. So all these doctors are our members, whether you're working or not. The thing, and that's probably why the strike has also lasted long, because we also gave members. So it wasn't a complete shutdown.
Yes.
That's not something for the county to brag, right? They also went ahead and hired a few junior doctors, which is fine, which was part of our agreement. But then all these are our members, right? They all get paid the salary the union has negotiated for. Then that's how unionism works. You get the salary where Standard Media Group unionized members, you join today, you're part of that, you get that. Now, let me talk about deaths, because I feel like we will talk about procedures and so many things here that are not even important to very many people. Why are people dying? When someone dies, I take it very personally, because I'm at the head of a strike that may be accused of someone dying. Now, from our own investigation, people in Kiambu are dying from 3 reasons. Only 3 reasons. Number 1 is politicization of healthcare by the executive. I think when I was here last time, I explained to you the story of a person in Nyagah, where you have a whole waziri seated in an office, swinging in a chair, deciding who gets referred or not. Because part of our protocol, if you're in the small hospitals, you get referred to the big hospitals. Now, to try and override that protocol means you're confining very sick patients to small hospitals. And by the way, just to give an update on that case, the ODPP looked into the issue, saw the evidence that is there, instructed the DCI. The DCI has summoned us for statements, has investigated, and actually in the next 2 weeks it will be telling us whether they are charging the executive of Kiambu for the death of that boy. So I take these things very personally, because to me it's very personal. I just to be a bit personal, my late father was sick for a very long time. I know what one sickness, one death does to a family. It's not a simple statistical thing where you show on the newspaper 36 people. Those are 36 different human beings and families. That's the first reason. We have people politicizing healthcare. The second thing is you have these junior doctors that have been hired being forced to do procedures they're not comfortable with. And if you want to
comfortable in terms of their training and understanding, expertise.
And even just scopes of practice. And because I know he'll dispute, the things, I have letters here. These are letters written to him. And these are multiple letters. You can see all these are letters, multiple letters, and I'll pass them. But I just want anybody to know that this letter is written, and the title is Challenges in Conducting Operations in Theatre. We, the undersigned medical officer of this particular hospital, we want to thank you for giving us this job. All this we do, I'm looking for where they say, in light of this, we respectfully request that we continue suspending all operative procedures until such a time that a consultant is reliably available. That is a doctor getting to a point and saying, I am treating people, they're not getting better. I have no supervision, I have no support. Where's the senior doctor I should ask what I should do in this scenario? To the point where, out of their own oath and practice, they decide, you know what, I'll write a letter to the executive and tell them, I'm not comfortable. This is a letter from from different hospitals. These ones are from another hospital, where they say, challenges in conducting operations, referral of theatre cases. Following the above, we wish to notify your office that we are unable to do this procedure due to lack of a second on call. Please find attached our plea. These are letters that are going on deaf ears, because to the county, you can see how he wants to brag that things are working. That's the second reason. We are having an issue where lots of, let me just pass this to you, where lots of doctors are being put in very difficult situations. It's okay, they were written to you, you've seen them before. They're being put in very difficult situations because they are not equipped to work in hospitals without senior doctors. Now, that's the second reason. The first one is they're politicizing healthcare during this strike. Second one is that they're forcing junior doctors to do it. The third one, which is even now more interesting, to try and cope with the shortage during the strike, what they're doing is they're trying to compel doctors who've been in administration for very many years to go back and start operating. Right? You can, both of us here, technically don't practice that much. I'm in the union full time. The last time I practiced was 2 years ago. My colleague here now, my senior, has been forced to go back to theater and start seeing patients. The truth of the matter is he doesn't even have a valid practicing certificate. And so that you don't think I'm besmirching them, again, Gen Z, if you're at home, just Google his name. This database is online. In fact, even don't Google, that's too much work. Ask ChatGPT, it will search the internet and tell you. And if you want to know, search his name, search my name. The people who are conducting these procedures now are people who've been in administration for years. They've not been going for what we call continuous CPD points, which is conferences, trainings. These are people who've been in offices, and now they are being forced to go back and do these things. My colleague here, I'm using him because I don't want to mention someone who's not in the room, doesn't even have a practicing license. That's an illegality by itself. So when I sit down and see that people are dying, and it's during a strike that we are conducting, those things pain me. And what pains me about it is we sat down for a very long time, thought through how can we protect lives, came up with a very good protocol that had personnel, referral protocols, places that these people should go, outside county hospitals that these people should be sent to. And then now we are having witchcraft being practiced right there in the middle due to the politicization of this issue. And that's why I am very passionate about these things. And that's why when I see stories of babies dying, and this was one of the reasons I stopped practicing, I get very personally attached to people who lose someone. Because I lost my father back then, as I said. The mothers who died, for example, I can give you an example. There's a mother who lives in Kisii Estate, near Ndarugo, which is near Waitavia, on your way on Thika Road. It's near Thika. That lady delivered a preterm baby. Preterm, you need to stay in hospital, the baby matures and stays for a while. Now, the strike starts, the senior doctors leave. And you'll see it's going to be in the newspaper. You don't have to believe me. In fact, I don't want anybody to believe me. Go fact check yourself. Right? I'm not a preacher. You don't need to take my gospel. You'll see because Standard found that mother, but I had followed up on the mother myself as the secretary of the union. Once the senior doctors leave, the new junior doctors and interns, in fact, she says it was an intern who started seeing my baby. The baby develops complications and eventually dies. Now, the pain that mother has, because now I have to look for her. There's a gentleman from Juja, Gashororo, same thing. The wife was at home 2 days in labor pains, decides to go to Thika Level 5 hospital. For those 2 days, actually the husband says, I was only seen once by an intern. We lost the pregnancy, and the other when she was taken for cesarean section, they had lost the pregnancy. This would never happen if there was a very competent obstetrician gynecologist at that facility.
So why are there, sorry, Dr. Muriuki.
Yes,
so why are there...
I'm sorry, I get a bit passionate when it comes to loss of life.
Why are there intern doctors who are working, essentially junior doctors, who are working, but the senior doctors are not?
Because, and I like the fact that you asked that question, because it means you're now understanding the situation on the ground. The interns are posted by the Ministry of Health. Kiambu doctors have gone on strike. So once the ministry sends the interns in July, the person on the ground who's going to see your loved one, and the issue of health is very personal. You might have a good cover, but you don't know where your relative or your aunt will land. If they're being seen by an intern, someone who's just finished university last year, or even maybe early this year, that is a great crime because that person is not experienced. So the reason they're being seen by interns is because there are no doctors.
So when we've said the doctors have gone on strike because of whatever the dispute may be, this does not include the intern doctors, which according to Dr. Nyagah, are still working.
Yes, because the interns, let me just finish because you've asked me the question. The interns are not on strike.
Okay.
They are not even employees of Kiambu County. Then they are part of studying just under the ministry.
They could go anywhere later.
They could go anywhere. In fact, once they finish their internship, they are free to, the world is their oyster.
Okay.
And this is part of why the ministry, when it did its own survey, realized actually having the interns there is more dangerous to lives than not having them. You'd rather go to a hospital and find it closed than assume it has competent and qualified personnel and then lose a life.
I have the question before I just lose it. Is it therefore, I could be wrong, Is it therefore true that the ministry is withdrawing intern doctors from these hospitals because they do not have senior doctors to supervise them and therefore cannot perform as expected of them?
Dennis, you are not wrong. You're correct. And actually, the letter the CS wrote to the governor was, because there is nobody to supervise these people, I am pulling everyone out. And that's why it's not just doctors, even the nurses. I mean, if there's no doctor, there's no case, all of them. And that's why the ministry then said, in fact, they're not removing interns to punish Kiambu. They're removing interns on 2 grounds. For their training, there's nothing happening, and to protect lives, because they've realized Kiambu is riding on the fact that they're interns sent from Ministry of Health to treat people. And yet these are very, very junior colleagues in the profession. In fact, they should not see someone without the close supervision of a senior person.
Dr. Patrick, do you have these letters? Because they've been sent to you. I can see Chief Officer Health Services. This clearly is you. And with these letters and all the demands in it, one would assume that this is something that you would have attended to and try to deal with it. Why does it appear as though the politics that you're talking about being propagated by KMPDU, it seems as though it is the county that is playing politics with healthcare?
Let it be on record that these letters were addressed to me.
Okay.
And let it be on record that these letters have come from Dr. Bill Muriuki. That's a matter of procedure. Let it also be on record that he's not copied in this letter.
He should be copied?
He has not been.
No, should he be copied if there's a letter that's coming to your office?
No.
Okay, so that doesn't matter then.
It matters because the letters which are official are supposed to be in the hands of people who have been addressed and the people who have been copied. Okay? Now, this is what I want to put in perspective, because this is what you do to escalate a crisis. We hired doctors in phases. Look at the letter, the date of that letter.
It's 2nd July 2025.
Thank you. We had hired doctors and placed them on 28th of June. We hired doctors in 3 phases. We placed them in 3 phases with a week in between.
Okay.
Each doctor group was going in with an orientation of a full week. We had instructed doctors, you go to your stations, you do your assessment, and you write back to us.
Okay. So they were hired by the county for the county?
Yes.
Okay.
And the doctors who have written those letters are county employees.
Okay.
They are not national government employees.
Okay.
They are not interns.
Okay. And the doctors who are on strike are also county employees?
Yes.
All right.
And those doctors who have written these letters are not interns.
Okay.
They are registered doctors. And so, are there doctors in Kiambu? The answer is right there. They have written. But they were following instructions that we gave. That you go to your centers, according to your level of competence and skill and registration, do your assessment and tell us what you're able to do and what you're not able to do. But according to our registration, you are all doctors. You are not half doctors. You are all qualified, but you might have skill gaps. Some of them wrote back to us, like the letters which have been snapped from my office by the union or collected from the hospitals by the union and used to escalate a crisis which we are solving. When they wrote to us, we were trying to plan the 2nd phase of placement and the 3rd phase of placement according to matching skills and requirements. But the best person to tell you what requirement you have is the doctor on the ground. It's not the union. By the way, Dr. Bill has never worked in Kiambu. He doesn't know anything about inside of a hospital in Kiambu. Dr. Davji has never worked in Kiambu. He has no idea of what happens in Kiambu. I have worked in Kiambu for 20 years. I have been to each and every of these hospitals. We have different capacities, different levels, different competencies, different skills, and different challenges. So there's no one size-fits-all kind of a deployment that will sort out all the problems, all the time, all the places. We keep on changing the mat according to the problem. Now, coming back to these letters, the ones who wrote, in the second deployment, we gave the skills that they were requiring. So you go to Thika today, he's talking of Thika neonatal unit. There is a consultant, 1, 2, 3 of them. You go to Ruiru, there is a consultant, 1, 2, 3 of them. We went ahead and added the consultants. But in KMPDU escalating the narrative, kind of, they went to court, and you cannot mention it here, got a court order to stop Kiambu County government from hiring doctors. They got a court order and stopped the process of hiring doctors for the third phase of hiring. And then come here and say there are no doctors. So this is escalation, and I think we need to see it for what it is. Let me finish. When they got a court order against the third phase of hiring, we had to go to court. We've been there with them for 3 weeks on that particular issue. They have 3 other matters. But on this particular issue of hiring, it was concluded last week.
Okay.
They were unable to continue. They withdrew it. We are hiring. If you look at your paper today, Standard, there's an advertisement for more specialists for Kiambu. This phase would have happened by 21st of July. These doctors would have been in the hospitals by 23rd of August. It was stopped by court.
Was the court order? The court order was granted.
It was granted by. It was taken under certificate of urgency.
But it was granted by the court.
Ex parte.
But the court granted the order.
Yes.
So usually when the court grants an order, they will look at both sides and they will ask questions as to why was this necessary to happen. From your understanding, why would a court grant an order to stop further hiring of medical doctors in Kiambu County if there was no issue?
In legal practice, ex parte hearings are had without hearing the other side. It is what you put there that gives you your initial orders. When we were heard.
You were heard later?
Yes. When we were heard, the matter fell off. Now we are hiring. The first order was a sneaky way of rushing to court and a certificate of emergency, no hearing of this side, put a paper on your side, you get an initial order, then the other one is given time to reply, and then you are heard. So in that initial phase, you've actually stalled the progress. And that is exactly what they achieved. And that is exactly what they are trying to escalate here.
Dr. I want to ask the question. Let's talk about healthcare situation in the county and the workers who are there and their salaries. As you speak on this table right now, of the workers that are in Kiambu County, have you paid your workers their September salaries?
The issue of salaries for county workers.
Why is it not a simple answer?
I think
how back should
I
we
gave
go?
you time to answer your questions. I did not cheer. I did not escalate, and I did not interview. Even as you are spouting a lot of falsehoods,
Okay, so
I
let's go
kept
to
my
the answer
peace.
to the questions,
Please.
Say we paid people.
So we, as county governments, and this thing is in the news, not this year, not last year, not the year before, for the last 4 or 5 years. In the period between July 1st and September 1st, we have to receive money from the exchequer, the treasury, not Kiambu only, but all the counties.
So the county is in arrears of paying the health workers for how many months?
We are not in arrears. The September salary is being processed now.
Okay.
The August salary is paid.
In full.
The July salary is paid. We are processing September salary. Today is September what? 3rd.
Today is October 3rd, actually.
October 3rd, sorry.
Yeah.
October 3rd. We are processing September salary. Yeah?
Can I just
There was a delay. Can I finish
Just
without
finish.
interference?
It will come to you just...
There was a delay in processing of September salary and August salary because of a delay of exchequer. However, Kiambu County used its own source revenue, paid July salary, paid August salary, and is processing September salary from exchequer disbursement, which came in less than 7 days ago. We all know that banking process from central bank to commercial bank to the individual has a process of days. And there are quite a number of offices in between. We've done everything for them to be paid. We are waiting for the transfer of the September salary from the central bank to the commercial bank. That is not an unpaid salary. It is a processed salary. We have paid full August salaries. We've paid full July salaries. Yeah? And these have been done while we do not have
Money.
The exchequer. Why? Because we are prioritizing workers. Previously, in last year, we had a crisis because the same kind of delay happened and we had less own source revenue.
Okay.
So we have been able to sort out those issues. But there's something that I don't need lost here,
okay,
please, before, because he said them.
Let's just
finish
face
on
the
the
issue that we
salary
don't need
issue.
lost. Yes. And then we'll
Yes,
come
there's
here
an
just
issue
one
here
minute.
which he raised very well and made it appear like the union was solving a problem, while actual truth is they were creating a problem.
All right.
Now there is an issue. I've not said
let's get to the
what
issue.
the issue it is, because we are talking about doctors at work being seconded by the union. It is a matter of law.
Unions don't hire.
Exactly. Exactly.
Unions
And that
don't-
is why I was very surprised that he was spewing it and you're quiet.
No, but unions don't hire. I don't.
He said that they forwarded to us. He even referred to me and said we forwarded him. I'm not an employee of the union. He said so here.
No, he
So
he said that there were members of the fraternity who were recalled to work, not forwarded by the union.
Yes.
That I heard very clearly.
Thank you for listening to
the
me.
issue here is
So it
when
was
the
not. I
strike-
think we need to clarify that. It's
Yeah.
important for us to say that he did not mention that the union forwarded individuals to go and work for the county. We know that is not possible. It can't happen.
Thank you,
because
Ndu.
they're not the employer in
Thank
this
you.
case. So I think we need to
so
clear
what
that up.
did the union do?
In this case,
in his
apparently
words?
nothing.
In his
Can I
words?
just come
Yes.
in now?
So
Please.
the point here was
This is why the strike has lasted for 4 months, because you can see we are in a pattern now. You raise an issue where doctors wrote a letter saying I'm not comfortable doing procedures. He doesn't deny the letter. He doesn't say what he did. He just says, oh, you are not CC'd in this letter. How did you get the letter? Can you see complete deflection of issues? But I want to come to the
I
salary
think we
issue.
need to put
Let's-
the
I
record
want
straight.
to come
I
to the
said
salary
we
issue.
posted
Okay.
doctors.
Let him just finish.
I want to come to the salary issue. I don't want anybody at home to believe me. No, this is a chart, and I can see there are Kiambu doctors. Just scroll. There's a doctor. There, in fact, like there are three. In fact, I've seen a nurse and a doctor. Just scroll up. There's someone who has said when they were last paid.
Catherine Mora says healthcare workers in Kiambu have not been paid.
Yes.
Third month now. We are talking about those currently working.
Okay, then scroll up again. You'll see Sandy. I saw someone like Sandy. Just go up. Just go up. I don't even, I'm so used to his pattern of trying to complicate things that a simple question of like, have you paid people needs a long explanation. There. Sandra, Sandy. There's a crisis in Kiambu. Even us who are working have not been paid for August and September. Today is October 3rd. So what you see here, Dennis, is what I'm saying. We have a pattern. And it's
Can
what I
we
was
prove
referring
that
to.
those people are employees of Kiambu?
Yes.
Can we?
I know them.
Is it possible to prove that those workers are in Kiambu? Because I can prove the people in Kiambu have been paid.
Okay.
I have a payroll.
Fine.
If people can write from anywhere and say I am from Kiambu.
I'll give him that.
It is not because there's a chart
Okay,
here.
let's clarify this issue. Because
I think we are getting into a situation where he's allowed to say all manner of lies, and we are not allowed to.
I take that.
This is a conversation that we will carry on in a way that we'll then be able to get some solutions through. Dr.
But
Muriuki.
I take back. Maybe they're just mad Kenyans who claim them people from Kiambu and somehow know the exact months they've not been paid. So I take that back.
You fight for the welfare of your members.
Yes.
Your members, you deal with them on a daily basis.
Exactly.
Have your members come to you with a complaint that they've not been paid?
Yes. And that's why even now on this chart, you can just see them. That's why I know them. They know they've not been paid. But the thing is, when you're used to lying without the ability for you to be proven, you get very comfortable in that bubble. And you can end up in a situation where someone can just expose you very fast. So the truth of the matter is, and Dennis, Ndo, you'll agree with me, if you've paid salaries, you don't need a very long story. In fact, what I was just thinking as he was explaining that, if this is the kind of bravado he has with salaries for 3 months, imagine if he used to pay them on time. What kind of confidence then would he have? Because this is the attitude of someone who's completely failed a department. But then now, going to the issue that...
I take exception to personal attacks.
It's not a personal...
I take exception to personal attacks. They're being allowed on this table several times.
Let's just...
At the beginning, he said that I'm operating without a license. I'm a qualified surgeon. Now he's saying I have failed to run an office. And those are personal attacks. And if I am about to, if he wants me to do personal attacks on him, I can. I am senior, I'm professional, and I do not want him to do personal attacks on me.
What we're doing right now is trying to have a conversation. So let's just carry on in that manner. So let's
talk about the facts.
Dr. Muriuki.
So I wanted to move back to the issue because if I let him direct the conversation, we won't talk about the strike itself. We will talk about counties and treasury and the rest.
You are talking about people.
Let's just carry on. Let's just...
And mind you, there are counties that have paid salaries, right? So let's not benchmark with the worst. So I just want to go back to the issue of the strike because that's where we are here. Why do we have a strike that is not being resolved? And I'll just put this as a theory. If you have a strike that lasts 4 months, it's a symptom of several things. One, an inability to solve problems. Poor leadership. These are just my theories. It's not a personal attack, but if you came and told me you have a strike that has lasted 4 months, I would say there's an inability to solve problems and maybe a vacuum in leadership. Now, where are the issues as they stand now? We have met with the county. We have agreed on the 10 issues. And let me stop there and say, the fact that the county has agreed on the 10 issues, first of all, is an admission that they knew they were wrong, right? Even though I come and claim money from you, and then now you agree to pay me within a certain day.
That means I've agreed that I owe you.
Yeah, okay. That it means even from the word go, you owed me, right? So return to work formulas tend to almost be an admission of guilt. Now, where the issue is and where it sits right now is there's a clause both parties are not agreeing upon. Now, this clause is at the end of that document, which is so sad. It's a clause that nobody ever argues about. It's a clause on no victimization. That as soon as we end this strike, all our members shall not be victimized for having participated in a strike. Now, that's the clause that all this rests on. The county is adamant it doesn't want to put that clause in the document.
Why?
And in fact, even I'll give them the grace of saying they claim they won't victimize anyone, but they just don't want it on the document. However, going on strike is a constitutional right. 2, this strike is protected. Why do you want to victimize people? In fact, if we could put that no victimization clause, that you will not punish anybody for having participated on strike, we can end that strike today. In fact, that is what makes this situation very, very sad, that we are stuck at a very simple point, that we're having people who say, okay, fine, we've agreed we have liability, we have agreed on the things you asked for, we will give them to you, but we want to preserve the ability to punish you after this.
Is that something that will, Dr. Nyagah, looking at the issues of this strike, it's obvious that there are issues that were brought to the table, and also by your own admission that you had some kind of coming together where you said, okay, fine, on these issues we agree on them, at least to an extent. Was there a give us time to kind of sort that out? But also one of the things that you had said earlier is that before you knew what was happening, they had pulled workers from the hospitals, right? But had you agreed to an extent that these are issues that are on the table and we are going to handle them?
To a straight answer, yes. But before I give you an elaboration, there's something he said which is cannot be left unchallenged. One, he says he's very passionate about deaths of patients. We are very passionate about life of patients. You cannot be passionate about death. That makes sense. You should be passionate about life. And the calling, the employment, the professionalism of a doctor is to protect death, not to hype deaths. To protect life when it is existing, not hype death when it happens. KMPDU has changed the roles. There's no healthcare system in the world. There's no hospital in the world registered anywhere from America to UK to Africa. A hospital that has never lost a patient. But doctors don't go hyping which patient died in which hospital. We hype the advancements in science and the effort we go to save lives, and we learn from the losses. All this KMPDU story, all these disputes would be solved immediately if we could agree on sanctity of the living.
But from what you've said, that you already did agree.
Now,
you said that you did agree. Sorry,
agreed.
Dr. Nyagah. You said you agreed on the issues and that you were going to handle them. What stops that agreement from continuing to take place even today?
Now,
on those 10 issues, which you said, fine, this is by your own admission earlier on, which you said, yes, we see that these are problems. What stops all of this from falling off and saying, okay, guys, those 10 things which we said we would sort out, let's sort them out now so that you go back to work? Is there something that stops that from happening?
We have agreed on 10 things. We have asked them to sign on the 10 things. They have added an 11th thing called victimization. They have added another condition which is not talking about, that they want to be paid their salaries for the times they were not working. And even if you don't come to work, I don't know whether you'll be paid. I am not sure that this company will give you 6 months to go away without work and give you money and you're not on leave. The issue is, those two are the issues that have raised all the other issues.
So if you ignored those two issues, those other 10 issues for which there was an agreement across board to be handled, can they actually be handled?
Those ones are handled. If they could sign.
If they were handled, they would be back at work. Dr. Muriuki?
They would have signed
the same day.
Why are they not signing?
I have. Let me just go through the issues here that you're talking about. Yeah. So the UHC staff absorption, and I'm reading these from the KMPDU in terms of what they wrote. Now, many counties have yet to issue permanent pensionable letters. Has Kiambu done that? Yes or no?
UHC are national employees.
Yes or no?
Yes or no? They are national
have
employees.
You issued permanent
yes
and
or
pensionable?
No?
We would only issue those letters if the national give us the letters.
Okay, so let's talk about career guidelines. The Council of Governors is interfering with the Public Service Commission, undermining career progression and professional ability. Has Kiambu County met the career guidelines as agreed with the KMPDU?
Yes.
Yes. Now we talk about remuneration. Full SRC reviewed pay structures remain pending in several counties. Has Kiambu County met the remuneration and full SRC reviewed as directed by SRC?
Long time ago.
Long time ago. Then if that is the question and doctors are saying all these have not been met, are you lying to us, Dr. Bill?
No, I think you are not reading the 10 issues. Remember there are 10, you've not even read 10. But I think the best place to pick this issue up is both parties have agreed on the 10 issues. And the part we've not agreed is in one document, and that document reads, how KMPDU proposes it, how Kiambu County proposes it. Now, again, I know he will try to create a scenario that doesn't exist. So I came with a document. In fact, I came with the one. I came with the one he filed in court. So it is his. We filed the same document, but I got their copy. Now, the
notice, this matter is in court. It is sub-judicial.
It's not sub-judicial. Actually, the other day, the judge said matters of the union, the documents, because if you serve the union, who's the union? The union is not me. It's a matter of all our members, right? So it's not sub-judice.
Is there an active case on
Do you
that
see
where
why the
that
strike
paper has not been judged?
If anybody at home can see why the strike has lasted, I want
where
to
that
the
paper has not been judged, where that paper, the judge has not seen it.
This is a document that this document lodged in court.
This document
Yes. Has the matter been heard?
Has this document been lodged in court?
Can I just answer? This document has been written by both parties. It's
agreed upon by both parties?
Yes.
Okay.
Because remember, it's one document, and the part we are disagreeing
Is
in
it
the same
lodged in court?
Okay.
Can I just be protected?
Is it
from
a court document?
I'm asking.
Produced
both of you,
on the paper.
This is the
produced in this platform.
This is the question that I am asking.
Yes.
Is this document created by the county government of Kiambu as well as the KMPDU? Is this document in court?
Yes.
Who created the document?
And the matter is not yet
created the
heard.
document?
Who created the document?
The document he has is his own version. We have our own version.
So if it's,
the two are in
if
court.
this version of his that you say is not the document that's in court, we can hear from it.
Yes.
If it's not the one in court, yes.
According to what you're
But
saying.
if it's in court,
Fine, I'll read my version.
then we have subjudicial issues there.
You know, if you see someone even fearful of reading a document, okay, let me just read. So it's one document. It's a draft return to work formula. The first 10 points, there's agreement on every issue. So the issues that took doctors to strike officially, they've agreed, we didn't promote people, we'll promote people in the next 6 weeks. There've been persistent delays in salary, as you can see. We will now sort that out going forward. We've not been remitting SHA, we will sort that out. So all these issues.
Statutory deductions.
Yes, it is one continuous document. We've been transferring people without paying them transfer allowance. We will start paying them. There's been lack of consistent medical cover. We will start doing that. We've had doctors working over 40 hours. We will hire more doctors so that stops. Union dues. Give us the formats of your members. We will start deduct. All the 10 issues have been agreed. Comes the contentious issue. Now, therefore, parties agree. The first thing is clause proposed by Kiambu County. The second part is clause proposed by KMPDU. Now, the reason he's saying it was lodged in court is because where things are, both parties then, if we cannot break that deadlock, there was the feeling that then let's take it to court, we see what the court will say. Can the court tell you can victimize people for going on strike? That has never happened, but if they want to be obstinate and be told what needs to happen, that's fine. So when we took it to court, the honorable judge before court 4 said matters of you don't even have to file them because a union is not an employer-employee relationship. It's not a private document. This is an entity of people. So essentially, I can even come here to radio to read to my members wherever they might be in Kenya what the government has proposed. That's not a private document. Now, if members at home want to know what the county is proposing and what the union is proposing, the union's clause reads, there shall be no victimization whatsoever by the employer of the leaders and members of KMPDU, including but not limited to, and then it lists any potential victimization. So it says withholding of salaries, arbitrary transfers, discriminatory assignment, it just goes down the list. Yeah. That's what the union is proposing. In fact, even the union says, and in turn, the union shall withdraw any court cases. That's what the union is proposing. Now, tell me, Dennis, as a reasonable Kenyan, this is what Kiambu is proposing. And I'll give you to read so that you don't think I'm being cheeky. That the employer will adhere to all laid down administrative procedures and principles of fair administrative actions when dealing with employees. These dealings will not be limited to disciplinary action, arbitrary transfers, and discriminatory assignment of duties. How do I, as a regional secretary, sign such a document that someone says we will deal with you fairly and it doesn't limit us from doing any of the following things? I can't sign that document. Doctors cannot go back knowing. In fact, that clause nullifies the rest of the other agreements, because the first thing I'd do if I was your employer is say, you first, the things we agreed do not apply to you, you're on strike. You get, so it even essentially nullifies the entire document. And so that you know I'm not making things up, please read. It's the last part that we're disagreeing on. And the simple question is this: why do you want to victimize people who exercise their constitutional right to get things you've agreed to give them?
Okay, so we're at this point now, Dr. Nyagah, where there's an agreement that these 10 issues were agreed upon, that there was an issue. So, I mean, if what we've established by this conversation is that there was an issue, County Government of Kiambu said, yes, we actually need to deal with this thing. The reason why we still have a stalemate, Dr. Nyagah, is that it has not been signed upon in terms of the agreement. And they are saying that there's a clause there that looks as though folks who might come back to work might be victimized, and that's what stops them from coming back. Do you see this as this might be an issue? Dr. Nyagah?
We've agreed on the 10 issues. We've agreed to sign the 10 issues. We will not agree to sign additional issues. And if there is an issue to be added, then it to be added.
No, my question was that there is a clause here. Maybe I think you were a bit busy at that moment. Okay. There is a clause in the document that was asking about victimization in terms of what would happen to doctors should they come back, which is a clause that was added by the county. No, there's a clause that is saying that the county should not then victimize anybody who might or might not come back to work after this has been agreed. Is that something that can be looked into?
And that clause is always the last clause of any return to work formula. Any. Because at the end of the day, you are restoring a relationship. It's like a relationship where you say, going forward, let's forgive each other.
Okay, and is that possible for people to forgive each other? So that these stories that we're hearing, Dr. Nyagah, of people who've not been allowed to go home with their babies, these stories that we're hearing of people who've been outside hospitals, who've not gotten medical care, can come to an end. Is it possible?
Let's put this thing in perspective. One, that every word of the law has a meaning in the law. And we are not in any way, previously or in future, planning or in any way done it in terms of victimizing people or employees. We do not, we will not, and we have not.
So this can be sorted. Yes. Even now, today, we can go back to work today.
Let me finish.
Even here.
Let me finish.
On live TV.
Let me finish. Where the trick is, when you read that clause, is the definition of that victimization. It deviates completely from the constitutional principle of victimization.
What's the law of victimization?
It is going to prescribe administrative action or inaction. Get some water. If that clause, if for example, we were to make an agreement, which we can any time and any moment, and we actually look forward to that agreement, and if we were to agree on the victimization or non-victimization clause, we have suggested that we forget what Kiambu County says, forget what KMPDU says, go to the Constitution, pick the legal part that talks about victimization, and insert it in the agreement the way it is written in the Constitution, without any definitions, without any additions, without anything. Because the Constitution was made by the people, agreed and voted on and accepted. The way it is, we just put it there. But do not add, among the things which are being added here are not victimization. They are procedures.
Okay.
So we cannot make an agreement which stops legal procedures, for example. We can't make an agreement that is unconstitutional. We can't make an agreement that is illegal. We just agree that victimization is not my word, it's not his word, it's a constitutional word.
In the meantime,
then we pick the meaning of the constitution and move on.
Daktari, with all these documents that we have here, letters, correspondence, and even matters in court, the people who are suffering are the people of Kiambu County and the patients. As this protracted battle continues, it is the people who are not accessing services. As you sit here as the CEO of Kiambu County, what are you telling the people of Kiambu County with regard to the constitution you're referring to in terms of access to quality healthcare and preservation of life in Kiambu County?
What you're saying to the people in Kiambu County is that Kiambu County government is a responsible government. We take care of your health. We sustain life. We put all resources available to make sure that the services continue. We have put in place mitigation measures that allow services to continue. We are asking citizens to keep on going to the hospitals and not listen to the dispute that we have with KMPDU. We are committed to sorting the issue with KMPDU. And we do not want misinformation or politicization of health.
Okay,
let that go on.
Yeah. Okay.
In terms of ending this dispute, we are committed to follow constitutional principles. We are committed to keep to the legal statutes that guide government.
So what you're saying,
and we are going to sign an agreement as guided by the constitution.
So what you're saying, is that there is a possibility that some of these doctors could come back to work even after you have an agreement, but there's also a possibility that some of them could actually be relieved of their duties because of the fact that they went on strike?
We have said that this is a protected strike. Their job is protected. We have not fired anybody.
And you will.
We are not planning to fire anybody.
Okay.
But on the other side, firing is not, and it is a performance issue. Because if you come back and you don't perform, even if you don't perform, you'll be fired. But we are not going to give you a guarantee, no matter how you behave, you will never be fired. The point is, the clause that deals with firing will apply even after the constitution, even after the strike is over. So we allow you to come back. We won't fire you for the strike, but we expect when you come, you give services. We expect when you come, you go to the wards. We expect when you come, you do your work.
Okay.
But if you come and still don't give work, still don't do your things, the law will apply. That's exactly what you're saying.
So, Dr. How are you intending to meet all the commitments that you've given here without meeting the demands of the doctors and ensure that quality services is received?
The misconception here is that there is a particular group of doctors who can give quality services. That's a misconception. We have doctors everywhere in the world. They can give quality services. It's not only the 70 members of the...
But they were working in Kiambu County.
Even them, they give very good quality services.
They were working. Okay.
And we are ready to bring them back and continue their work. No problem.
So you're ready to... Okay. If anything, we've established that the county government of Kiambu is ready to bring these doctors back. Those 10 issues that have been the issues of contention can actually be sorted. And they said, Dr. Muriuki, they're not going to necessarily kick anybody out because they went on strike. You said it here. And perhaps we're going to the place where there will be an agreement then that will be signed, as we actually see WTFs all the time. The last question before we have to let both of you go at this hour, and I have to say, thank you for being able to do this morning. Where is the county governor of Kiambu in all of this conversation? Has he said anything? Has he addressed anybody? What would he have to say about how things have been working or not working in the county as concerns health up until this point? There have been too many murmurs, there have been too many stories, and yet we've not heard his voice about this, and you work directly under him.
The governor has pronounced himself very clearly, and he has said that he's elected to serve the people of Kiambu, and he's serving people of Kiambu. He has, despite the dispute, enabled us to hire more workers. He has increased the capacity of the hospitals. He has provided resources for all supplies required in Kiambu. He has led from the front in terms of solving this crisis. He has offered. The governor has met these people since he was elected. He has met them numerous times.
Has he met Dr. Muriuki?
No.
You've never met him?
Straightforward answer, no.
Okay, that's never happened.
This is Dr. Muriuki works in Nyeri. He might not have met
Oh, there are
our
other
governor.
doctors. There are other doctors.
the
that
other
you may
doctor
have met.
leaders in Kiambu. The ones who work in Kiambu, he meets them. You can call them and ask them. I've even found them in his office.
Okay.
So he doesn't work there. He can't continue escalating things that don't exist. The workers who are the members who are workers of Kiambu, the governor has been to every hospital. I've accompanied him. He has had caucuses with workers. He has met the representatives. In the July of 2023, about 7 months after he was elected, the first function we did with the governor was promoting doctors. Even before they went on strike for promotion, we had promoted our doctors.
Okay.
In the next cycle, we were promoting. The governor has been on the forefront of improving health in Kiambu. The issue of the dispute, and that is why we are here, is because there are some constitutional issues that need to be sorted out.
So can we agree that you will pen to paper, I don't know, yes or no, that the victimization clause you will agree together with KMPDU, yes or no?
We are ready to agree like yesterday.
Okay.
Okay.
And we don't want any definitions. We just want go to the Constitution, look what it says about victimization, put it in the agreement, bring it in the morning. We sign it before sunrise.
So we could actually start next week with these things going.
Even tomorrow.
And having been sorted out. There's a lot in terms of still underlying issues here, obviously. And I guess getting to the point where there was an admittance of an issue in the first place probably would have gotten us 50% of the way first time. There are those who are still asking questions about being paid. There are those who are saying, yes, I am a county government employee, looking for some of those things. So it seems as though there's a lot still to be answered and sorted out. Thank you, both of you, for being here. If we got to the point whereby there was, in word at least, an agreement to say that we'll have this sorted out, perhaps we've reached somewhere that we were not where we started.
Yes.
It's just putting it to paper.
Putting it to paper and making an agreement.
Because as I said, and do remember, they say they won't do it, but they don't want it on paper. And he somehow wants us to get a definition from the Constitution. And anybody who's ever read the Constitution knows it's not a dictionary. It doesn't give definitions of things. So let's just put it on paper. In fact, there's nothing more suspicious than telling someone, I will not do this, but don't make me commit it on paper. That is the first red flag. And as I said, this feels like a very toxic relationship with lots of red flags. But thank you, Ndu. Thank you, Dennis.
Thank you both for being here. And let's hope that the next time we're having this conversation, we're talking about how we have those issues having been sorted out. Thank you so much. Dr. Bill Muriuki is the KMPDU Regional Secretary, Central Kenya. So, Nyeri or not, to cover the area.
Yes.
Dr. Patrick Nyagah is a Chief Officer, Health Services, Kiambu County. Asante sana, both of you, for being here. It's 9:03. Conversations continue. Good morning.
This is the Situation Room, the only way to start your day.